Hi everyone, I'm Dr. Chad Woolner and welcome to episode number 3 of Your Daily Health Map. Today we're going to talk about some simple, effective exercises that can actually help improve shoulder stability and also even help you avoid surgery. So let's get started. So today what I want to talk about is some simple, effective shoulder exercises that can help improve shoulder issues, meaning pain and function, but more importantly, these exercises, if done correctly and at the right time, can actually even help you avoid needing surgery on the shoulder, which we see a lot of. We see a lot of patients who have had unnecessary shoulder surgery when they could have simply done a few simple exercises to help avoid these sorts of things. So what I've done here is I've kind of drawn up a crude illustration of kind of the shoulder anatomy. You can look it up online and follow along with me. If you go to Google Body, that's a great reference. Look at the shoulder. But basically what you should see here, right here, is this is what's called the humerus. That's this bone right here in your arm. And right above it, you have this shelf that is made up of what's called your acromion process, which is part of your scapula or your shoulder blade. And that meets up with your clavicle, okay, right here. And so your collarbone. So this meets up right here, forming what's called your AC joint, your acromioclavicular joint. And what's critical about this is right underneath that is right where that humerus rests, and its joint is right in there. And underneath this acromion process, underneath this AC joint, you have several muscles and tendons that come around and attach right in that area. Right up in here you have one of your rotator cuff muscles that comes in and kind of wraps around like that. You have your biceps tendon that comes through that area. So you have a few critical muscle groups that actually travel right underneath that area. And what happens is the rotator cuff muscles, which kind of all wrap around and kind of help to stabilize that joint there, where the humerus connects to the glenoid, which is again part of the scapula. If those rotator cuff muscles either get injured or get kind of inactive and weak and aren't stabilizing effectively, what can happen is this humerus can start to impinge, kind of, which means it starts to kind of literally bang up against that area, the acromion process or the acromioclavicular joint. And what it starts to do repetitively over time is causes some wear and tear on these muscles and these tendons right in there. And eventually over time it causes inflammation, pain, and even worse, it can actually lead to deterioration of those muscle tendons to the point where it needs surgery. And so what we want to do here is show you some simple, effective exercises to, number one, help alleviate some of the pain and inflammation that's caused by impingement syndrome, or this impingement in there. And then number two, just as important, some stabilization exercises to help keep that humerus nice and stable from preventing it from repetitively banging up into that area and impinging. So first things first. First, we want to show you some real simple exercises that you can do to help reduce some of the pain in there. So the first exercise we typically will prescribe for our patients is what's called Codman arm swings. And basically what you can do is get a 2.5 to 5 pound weight, depending upon what feels good for you. And you can actually use this weight to kind of traction down on that arm. And so what I mean by that is you can actually lean over a surface, a table, a bed, a chair, kitchen table if you want, counter, and you're going to hold that weight in the shoulder that you're wanting to work on in that arm. You're going to lean over and you're just going to use your hips and your body, let that arm limp, to circle around. So you just circle clockwise, counterclockwise, and just let that. And what you'll do is as you feel that weight in there, you'll feel that literally start to traction down. And what you're doing is you're kind of pulling down to let those muscles, or let that area open up a little bit, kind of help clear out some of that inflammation that's in there, help stretch out that shoulder joint there, and it'll really, really help. If you don't have weights, another simple, effective way is you can actually go out and buy a half gallon of milk, fill it up halfway with water or full way depending upon how much weight you want. Typically halfway is enough, and you can swing that around. That's a real cheap and inexpensive way to do that same exercise. So number one, Codman's arm swings. That's a great exercise to do. Number two, right along with that, you can buy a dowel at Home Depot or Lowe's, or you can use your broomstick, broom handle or whatever. And these are wand exercises is what we call these. So if I'm having problems with my left hand, the left hand is going to do the exercising. This is going to be the arm that's going to get exercised. You put the palm of the hand at the end of the dowel or the end of the broomstick, and the right arm is going to be doing all the work. The left hand is going to be passively being pushed into various ranges of motion. Now obviously you want to avoid any sort of pinching. If it's causing any sort of pinching pain, you obviously don't go in that direction. But you basically just go through different ranges of motion. External rotation, full extension of the arm, abduction of the arm, and basically just go through and spend about 10 to 15 minutes just working that arm. Notice my left arm isn't doing anything. It's just passively being moved by the right arm. The right arm is doing all the work. Or if your right shoulder is the problem shoulder, same thing. Basically just go through, do a series of motions like that. That's another great way to stretch out those muscles and kind of help work out some of that inflammation. The key to both Codman's arm swings and the wand exercises is their passive movements. So they're really gentle on the shoulder and they really help to improve motion. Motion is one of the best things for injured areas, and that's one of the common misconceptions that people have is they want to stabilize those areas and really immobilize those areas. Immobilization is necessary at some time, but for chronic injuries, for chronic shoulder issues and things like that, mobilization is fantastic. So getting movement in there is going to be a really good key there. So that's kind of phase number one. We want to get rid of that inflammation, reduce the pain. Phase number two is a stabilization phase. And so what we want to do for phase number two is work on some exercises to help re-energize those muscles, get those reactivated to start working properly to stabilize that shoulder joint. So here's a simple piece of equipment that you can use. TheraBand, rubber band, rubber cord. You can get it online for 10, 15 bucks. And basically this is a door piece that you can slide into the door and lock down. And so we close the door there. Basically there's 3 different exercises we do that we prescribe for our patients. The first one is what we call external rotation. And basically what this is going to do is work some of the rotator cuff muscles. So basically what you're going to do is externally rotate the shoulder. And you notice my elbow is bent at a 90-degree angle. Elbow is pinned to the side there, not flaring out like that. And this really does a great job of isolating some of those rotator cuff muscles, namely what's called your infraspinatus and your teres minor. And that does a fantastic job for those areas there. Okay, external rotation, that's the first one. Internal rotation is another one we want to do. So if I want to internally rotate, this is going to primarily work your subscapularis, which is part of the rotator cuff as well, and your teres major. And so when I do internal rotation, it's going to look virtually the same, except I turn around and instead of pulling out, I pull inward. So you notice here, pulling inward like that with this arm. That's internal rotation. So you want to do that as well. And typically what we'll do is we'll prescribe anywhere from 3 to 5 sets, typically anywhere from 10 to 15 repetitions, and basically spend about 10 to 15 minutes. This whole routine, if you're doing all these exercises together, shouldn't take more than 20 to 30 minutes. Okay, so those are the first 2. The final exercise, which is just as important, if not more so important, is one that we work what's called the supraspinatus muscle, which is a really critical stabilization muscle. The way that we do that is you just pin the band down with your foot on the floor, and let's say I'm going to work my left supraspinatus. You're not going to go straight out to the side of you, and you're not going to go straight in front. You're going to go about 20 degrees in front of you, thumb facing down like you're turning over a watering can. They call this empty can exercises. And basically, you're going to pull upwards. Okay? If you need less tension, give yourself a little bit more slack. You basically pull upwards like that. And that's going to work that supraspinatus muscle. Again, if you feel any sort of real severe pinching or irritation of the area, don't do it. Hold off on doing it. It might be a little bit too soon. But all in all, that should give you a very comprehensive shoulder rehab workout where you can really help to retrain your shoulder, get rid of a lot of the pain that's in there, and hopefully even avoid surgery. We've seen many cases that we've been able to help avoid surgery through just simple, low-tech exercises like this. So, hope you enjoy this. Use this exercise for any shoulder issues that you have, and hopefully you can get better with your shoulders and hopefully avoid surgery altogether. So, thanks for watching again, and pass this video along if you enjoyed it. Thanks.